You ever notice that when people are struggling, we don't say that they're falling out of care? We say they're falling out of control, that they're falling out of control. And I think that's an important thing that we need to start adding into our conversation about mental health, is that there is a lot of conversation about caring, that not enough people care around people who are struggling, and that people who are struggling need to go and ask people for help when they need to lean into the care. So one of the reasons that people don't do that is because when they care about someone but know that they don't have the resources to help them, they don't want to burden them with the responsibility of saying, hey, Sandra, I'm in a bind, I need $500, or I need a new job, or I need someone to look after my kids, knowing that Sandra has no dollars to spare, 6 kids of her own, and can't provide that kind of help. But once I've asked her, I know I'm going to feel like I've put it on her, that she's going to have to go and take on this responsibility of trying to sort it out. And I know she cares, and that's why I haven't told her. Not because I don't think that she doesn't want the best for me, but I don't believe that she can help me with what's going on. It's the same reason we don't ask our lay friends for really complicated medical advice, because they're not the people to ask. The people we do ask are the doctors, because the doctors know and they have the resources to help. So what we're missing at the moment in the infrastructure around mental health is not more discussions about how people need to care more, or that people aren't reaching out because they're bothered by the fact that they need help. People are bothered by the fact that even if you need help and you reach out for it, you're absolutely not guaranteed of getting it at all. You can say you're having a tough time to 20 different agencies, and they will listen to you and they will care and they will do nothing else to resolve that issue. And if you have a little bit of help but they don't resolve the issue, and you've leaned in to help 2 or 3 times, well, your trust then is damaged that anything good can happen. So you start again to lose agency further. When the help comes with a million strings attached that take away from your sense of agency, then again, you don't lean into that kind of help because you're losing control of your own life, or it's getting worse. And if we look at people in certain circumstances, the terminally ill, who get to a point where they go, unfortunately, they're a degenerative disease, it's only going to get worse, it's not going to get better. This is definitely going to kill you. And now, fortunately for them, in my opinion, and the opinion of many people, they have the option for euthanasia, because we understand that it's no life to just live suffering unnecessarily with no hope of a reprieve, no chance of getting better. So just degenerating because you could and feeling terrible all the time, it's not a great result. Unfortunately, when people need help in any other capacity, they're struggling with their bills, they're struggling with their family life, they're struggling with their schooling, they're struggling with their friends, we don't treat it the same way. And people who are in a really bad place are usually in a bad place because of a feeling of a loss of agency rather than a loss of care or a lack of care. Now, don't get me wrong, there are some people who need care around them. They need people to care, and as social animals, it's important that we pay attention to one another, that we step up and look after each other as communities, and that we do the right thing 100%. But all the care in the world from someone who's not an oncologist will not cure cancer, much the same way as all the care in the world from people who don't have the resources to help, or that operate in a system where resources to help are not collated and delivered to people in need, doesn't solve the problem. Rocking up and saying I have a broken leg and having someone tell me I was brave for telling them and thanks for sharing my story, and then not fixing my broken leg does not solve the problem. Rocking up and saying I have a broken leg and someone saying what you need is diet and exercise, or what you need is meditation, or what you need is a holiday, or what you need, okay, well, what if I don't have time or resources to maintain a diet, or I don't understand it and I don't get it and I don't see the benefit of it. I don't have the time and resources to go to the gym. I don't have the time and resources to have a holiday, and I have no idea about meditation. I'm certainly, of all the things, when I can't pay my bills and my family are mad at me and I'm struggling at work, and all of these other things, don't really feel like the meditation is going to be the answer. Whether it is or not is inconsequential. I've got these serious material problems that need dealing with, and if no one's going to help me with those, why would my first step be take a little bit of time and just sit around and meditate? I can't eat. My family is hungry. I can't get work. So these things are really, really important when we start to mature our conversation about mental health and say, look, while it is our responsibility to take more care for one another, 100%, that we should take more responsibility for the most vulnerable in the communities. But that responsibility doesn't stop at a token amount of caring or a poster in the tea room or a morning tea or a post that says, hey, if you're having a bad time, come and talk to me. What we need to do is take responsibility for building out resources that actually finish the job of helping people beyond talking, beyond the posters, beyond the tea room, beyond the things on social media. What we need to do is invest in building resources that take into account the complex needs of people that are feeling like they have lost agency of their own life, that they have lost control, and helping them regain it, not just by sort of giving them a few mental strategies, but by giving them the material help that they need to get back on their feet. Some people might need that for a number of years, and if they do, we should be giving it to them. And some people might not need it for that many years. Some people, if you catch it early enough, we might be able to right the ship early days, and that's really important too. Much the same way as my broken leg, if I leave it for 6 months, is now a really serious problem. If we'd have just fixed it on the day, it wouldn't have been as big a deal. If 6 weeks later I would have been back on my feet again. It is the same with mental health. And every time we tell people, all you need to do is care more and all you need to do is ask more, or we tell the people who are struggling the most, all you need to do is stand up and say, I'm having a bad time, only to then go and talk to those people and find out that every time they've done it, the help has not been forthcoming. So they don't believe the help's going to happen. As we mature our understanding in this space, we can move away from the model of people standing up in front of you and saying, guys, all you need to do is just care a little bit more and everything will be fine. Because that's not the case. Caring a bit more is great, but that's an entry point. That's not the end game. And we don't need more people standing up saying, well, this happened and all that needed to stop this was that we needed to just ask this guy a few more questions. That's not the case either. What we need to do is give people the tools to regain the agency of their own life. Some of those will be internal. Some of those are in personal development. Some of those are helping people develop as individuals. But some of them are about the kind of help that we actually build around people that need help as well. You can look after your health at home. You can do things to improve it, but when you get sick, when you get sick, minor sickness, you can go to the pharmacy. Serious sickness, you go to the hospital. Stuff works out. We need that same model for mental health. You have tools for helping your mental health at home. You have tools for if there's a little bit of a problem. So, you're having a particularly rough day, things are going bad for a week. But as things get worse or you have a serious problem, we need the environments around them that aren't just extensions of talking. We need actual resources around people that take into account the complex needs of people who have lost control of their own lives, or at least feel like they've lost control of their own lives, and help them regain control. It really is time that we matured our conversation around mental health. And we'll be leading that here from the Just Be Nice project every single day.